The health sector is groaning under the weight of COVID-19, with doctors, dentists and pharmacists crying out for help from the government. Union representatives have been scathing of the government's support for the sector so far, painting a bleak picture for MPs on the Epidemic Response Committee this morning. Here's our Deputy Political Editor, Craig McCulloch.
Health workers have been touted as the front line against COVID-19, the Prime Minister praising them for their essential service. Today they lined up to say thanks is not enough. They need money.
We don't know whether some practices are going to survive this.
Kate Baddock heads up the Medical Association, the voice of doctors around the country. She says many GPs are struggling to make ends meet. Despite the country being in a health crisis, the number of patients seeking appointments has dramatically dropped, and GPs' incomes along with it.
That cash flow which funds payroll, it funds our staffing requirements, is just not there. Quite literally, is just not there. And so the ability for general practice to stay afloat in this kind of environment is very, very unlikely in lots of cases.
The government has provided a cash injection of $15 million to cover the cost of shifting to virtual appointments, $8 million to help with testing, and then another $22 million after that, $45 million in total. But doctors say they were promised another payment of $22 million and were told this week it's not coming.
They have reneged on that expectation, and the final tranche has not been forwarded to general practice.
We have recognised the costs they've faced and we have worked hard to try and support them as well.
The Prime Minister, Jacinda Ardern, has refused to explain why that second payment of $22 million is not forthcoming, but she insists GPs have not been left in the lurch, pointing out they also have access to the wage subsidy scheme.
I do not think $45 million is an insignificant sum when we think about the support we're trying to provide across all of New Zealand, including businesses across all of New Zealand.
Others in the health sector also crying out for help. Community pharmacies warn they too could be forced to shut. Their costs have gone up, but sales have dropped right away.
This is delicate, pressing and urgent and needs attention immediately. We thought it needed attention 3 weeks ago. We're pulling our hair out.
The Pharmacy Guild's Chief Executive, Andrew Gordon, says their calls have fallen on deaf ears, with neither the Health Minister nor Director General of Health making themselves available. He acknowledges an initial $15 million of support, but says it's not enough.
The numbers don't stack up. I'm a chartered accountant. I'll tell you now, pharmacies are in the red ink, and it's only a matter of time before the dominoes start to fall and they can't pay their creditors, they can't pay their bills for staff, they can't pay the bills for rental.
The plight is even worse for dentists whose doors are shut during the lockdown, apart from for emergency care. And the Dental Association's president, Dr. Katie Ayers, says apart from the wage subsidy, they've received no extra funding. 1 in 8 practices, she says, have already laid off staff.
While it's hoped that most small businesses in New Zealand will survive another 3 weeks of closure, already some dental practices are facing bankruptcy.
All 3 professions, doctors, dentists and pharmacists, spoke of difficulties securing protective equipment, such as masks, at various times. They also spoke of confusing and poor communication from the ministry. But most of all, they want more government support. The country in the grips of a health crisis, but the health sector hurting too. For Checkpoint, Craig McCulloch.